Hey, I'm David Mullinex, and I'm here with Katya, and she's going to be helping me demonstrate how to do a full feline physical exam. The first thing I'm going to do when I enter the room is I am going to assess the mentation, the behavior, and the general attitude of the patient. Katya seems to be overall laid back. She is a 15-year-old spayed female, which kind of comes along with the territory in a lot of cases, but she is a sweet girl. I do know her personally, so I do kind of have a jump ahead as far as knowing her attitude and behavior. So first thing I'm going to want to do is I'm going to assess her hydration status, and the way I'm going to do that is I'm just going to pick up some fur and some skin along the back. I'm just going to make sure it's snapping in place properly, which in her case it is. She seems to be well hydrated, which is a good thing for her and for Riverview since she does live here. Next, I'm going to go ahead and start getting my vitals. The first vital I'm going to get is the weight, and I do have my scale back here. She weighs 7 pounds and 3.5 ounces. I have my chart here, which tells me that she weighs 7.22 pounds. Okay, and then I'm going to go ahead and get her temperature, her pulse, her respiration, her muscle memory, and her capillary refill time. I'm going to save the temperature for the last thing I get because I don't think she's going to be a big fan of that, actually. So I'll go ahead and take a look in her mouth. And I'm just going to press down on the gum and just make sure that it is a proper capillary refill time, which it was in her case. It was less than 2, which is good, and the muscle memory, she was pink and moist, so that checks out very nicely. I'm getting hair all over me.
You're so furry.
Okay, and then after that, I'm going to get her heart rate, her pulse, Her heart rate was 160, which is actually in this clinic was pretty low for a cat, but she is a older female, so. But it is in the normal range. So while I'm listening to her heart, I'm going to go ahead and listen to all 3 points on the left side, and then the 4th point on the right. Okay, and it does sound good. I don't hear any type of murmuring or anything like that. All 4 points sound good. While I get her respiration, I'll go ahead and listen to all 9 areas of the lungs. Okay, her respirations are right around 50. And while I'm listening to her lungs, I'm going to go ahead and listen to all 9 points. Okay, and she does sound super good. A lot of areas, I'm good. I didn't hear any wheezing or any leakage of air, anything like that. And for all 9 points, there is an appropriate area and an appropriate length of time to listen to that area. And I'm going to go ahead and get her temperature. She's not a fan of this, so we're going to go ahead and get her slightly restrained. Okay, and her temperature is 100.4, which is in a good range for a cat. So that looks nice. Okay, and then we'll go ahead and work our way through the systems. Okay, first thing we're going to look at is her eyes. Right off the bat, I don't see any kind of discharge, any discoloration, any kind of swelling, or any kind of trauma. And I'll grab my scope here, and I'm going to take a look into each eye. And it does look nice. Go ahead and take a look at her ears. Okay, there is a little bit of wax in there. Nothing super abnormal though. We should go ahead and clean them, but it's nothing of much concern. Go ahead and take a look into the inner ear. Okay, and we do have nice coloring, and she probably will need an ear cleaning, and that's something that we definitely could take care of. And I'm going to take a look at her teeth. Okay, she does appear to have mild tartar buildup, a little bit of discoloration. Nothing too bad though. Premolars and molars look good. It's mainly just that. Okay. Okay, and then I'm going to check her skin condition. And what I'm going to do is I'm just going to start from the back here, and I'm going to run my finger across, pushing back all the fur so that I can actually see the skin. I'm looking for any redness, any swelling, any scabbing, anything abnormal. And with her, I'm not really seeing too much here, which is awesome. Her skin looks very good. And then I'll go ahead and check her circulatory. What I'm going to be doing here is I'm going to be filling the femoral artery at the same time that I'm listening with her heart, to her heart, and make sure there's not a pulse deficit of any kind. Okay, and it seems to be synced up nicely. Okay, and the respiratory system, I was able to listen to all 9 areas on both sides, and she did sound good as far as her breathing and her lungs go. And neurally, when I shined the light in her eyes did constrict and dilate properly. She is standing fine, and she seems to have full control of everything that she's doing. She seems to have very good neurological control. Musculoskeletal system, I can go ahead and fill these areas, which it kind of feels like there is a lack of muscle. I'm going to go ahead and stretch out. And do that on the back as well. And back here, there's some definite muscle atrophy. our gut. Okay, and while I've got her facing this way, I'm going to go ahead and palpate her stomach, her bladder, and just make sure there's nothing abnormal that I can feel. Yeah. Her stomach feels good, her bladder feels good. This small, but it seems still alright. Nothing abnormal to report as far as that goes. And I'll go ahead and check her vulva. Make sure there's no discharge and swelling, no redness. Thank you. Okay, and that does seem to look clean and not inflamed in any way. And then I'll go ahead and check your lymph nodes for any swelling. Yeah, and I don't feel any swelling. If I did, it usually indicates some sort of infection going on in the body. But overall, she seems to be a healthy geriatric. She is 15 years old, so the muscle atrophy is expected with a cat of her age. Other than that, she looks good, she sounds good, she's an appropriate body weight, skin looks good, head to toe, she's a good looking cat. She's just kind of got some age on her. But overall, she's is looking good. So, alright, that's how you do a full physical exam of a feline. Good girl.